What in the world does your energy level, maybe even your day-to-day mood, have to do with your dentist? Well, the connection isn't real obvious at first, and depending upon your dentist, there may not be much of a connection. But at Mahoney Family Dentistry, we understand the intimate connection between a good night's sleep and modern oral health care. So we're working directly with some of the finest sleep experts in the region to help you and your loved ones with the sleeping disorders often caused by oral issues. Do any of our patients sound like you?
I'm a tooth grinder. I grind at night.
I was snoring crazy, and it was terrible.
My issue was snoring. My husband was not sleeping.
I had a snoring problem, which really bothered my wife a lot, and she would tell me sometimes, well, you sound like you quit breathing. And I just thought, well, it's just part of the snoring thing, right? But then I had another problem that I did not connect at all, and that was for at least a couple of years, I had gotten more and more fatigued.
Wasn't feeling rested, very irritable. Just the quality of health had been compromised.
I felt more and more tired all the time. And I was actually going to an internist, having blood workup done. You know, is it thyroid, is it heart, is it, you know, blood sugar?
I had to sleep in the other room for a while. My grandkids, when they'd come over and they'd say, oh, Papa's snoring so loud. And I said, I've got to do something.
Is it testosterone? You know, I work out 7 days a week, have for 20 years. I should not be feeling tired all the time.
My husband wasn't sleeping, and so he would oftentimes have to go and relocate throughout the night.
Made no connection whatsoever to sleep apnea or that problem because I'm lean, never even was on my radar screen.
I'm a tooth grinder. I grind at night.
There's various theories as to why we're grinding.
And I have a sleep disorder along with it. So putting the two together has been complicated because I've created problems for myself.
It might be related to chronic pain. It could be that their tonsils are enlarged and so they're having trouble breathing at night because of that, and they're constantly shifting their jaw forward. And we see it a lot in kids.
Dr. Mahoney and Dr. Clower are two of the physicians in this area that have embraced sleep disorders.
If it's severe, then we're not going to be involved. But if it's mild to moderate sleep apnea or a snoring problem, we can address those, and that's what we do.
Not every dentist has had the same passion for understanding patients with sleep disorders.
And then I go to them and I start talking about this for snoring, and I start seeing videos like this where people are saying, I'm tired all the time. And all of a sudden my symptoms, I'm like, that's exactly what I have.
And we can refer those patients to appropriate places to have sleep studies.
And I went and did a sleep study, they confirmed it. I said, wow, you know, that's causing my multiple year health issue, and I didn't even know it.
Today, advanced dental appliances are being fitted to individual patients' mouths to eliminate or moderate to a significant degree some of the most common tooth grinding and sleep apnea problems, sometimes avoiding costly surgery and cumbersome machines.
The gold standard in treating sleep apnea is the CPAP machine. But unfortunately, compliance with the CPAP machine is so poor. People just don't want to have a cumbersome device. So if you have mild to moderate sleep apnea, then the snoring appliance works very, very well. It is a great sleep apnea device. It stops people from snoring.
It saved my life, really, and it saved my marriage because my wife couldn't sleep.
The difference is stunning in how you feel. I mean, even at work, I'm more alert, I can focus better.
It was amazing that other things were solved also. So I wasn't waking up with the pain in the morning, the headaches and the jaw aches and the neck aches.
I mean, it's just a miracle.
And it worked on the first night. It's worked ever since.
I've always sought out dental colleagues because I truly believe in the team.
We just want to be part of the team that treats these patients, and dentistry is just one part of it.
When we're able to help with their breathing disorders and sleep apnea, you're really changing the quality of their life.
I'm sleeping unbelievably better.
Our practice is all about doing what's best for our patients. They're number one. If we don't have patients, we don't have a practice. So we do what's best for them. And what's best for them is treating their overall health.
Mahoney Family Dentistry, screening for sleep disorders, offering effective, often life-changing solutions in partnership with other medical professionals throughout the community. You and your family. Mahoney Family Dentistry.